Hello, students. In this episode, we will learn vocabulary about rehabilitative nursing. Please review this episode several times to ensure you know the vocabulary well. Module 14, Rehabilitative Nursing. Statement of purpose. The purpose of this unit is to introduce the nurse assistant to restorative care. Each individual is entitled to reach her optimal level of functioning. The nurse assistant assists the patient/resident in achieving maximum independent living skills through use of rehabilitative or restorative procedures. Performance standards, objectives define key terminology. 1. Active assistive range of motion. 2. Active range of motion. 3. Activities of daily living, ADL. 4. Adaptive. 5. Airbed, Kinair, Clinitron, Hillrom. 6. Alternating pressure mattress. 7. Ambulation. 8. Atrophy. 9. Bed cradle. 10. Cast. 11. Contractures. 12. Decline. 13. Decubitus. 14. Disability. 15. Egg crate mattress. 16. Embolism. 17. Eversion. 18. IDT interdisciplinary team. 19. Heel/elbow protector. 20. Fleece pad. 21. Flotation pads. 22. Footboard. 23. Hemiplegia. 24. Independence. 25. Inversion. 26. Joint. 27. Open reduction internal fixation, ORIF. 28. Paralysis. 29. Paraplegia. 30. Passive range of motion. 31. Phlebitis. 32. Pneumonia. 33. Pressure ulcers. 34. Prosthesis. 35. Quadriplegia. 36. Range of motion, ROM. 37. Restorative care/rehabilitation. 38. Risk factors. 39. Self-care activities. 40. Stasis pneumonia. 41. Thrombophlebitis. 42. Traction. 43. Trochanter rolls. 44. Turn, cough, deep breathe, TCDB. 45. Waterbed. Patient, resident, and client are synonymous terms referring to the person receiving care. Module 14 Vocabulary Sentences for CNA California Exam. Practice sentences for adult English learners. The nursing assistant provided active assistive range of motion by gently helping the resident move her shoulder while she tried to lift her arm. The physical therapist was pleased that Mr. Johnson could perform active range of motion exercises by moving all his joints without any help. Activities of daily living include basic tasks like brushing teeth, bathing, dressing, and eating meals independently. The occupational therapist ordered an adaptive spoon with a large handle to help the resident with arthritis eat more easily. The doctor ordered an airbed for Mrs. Smith because she was at high risk for developing pressure sores from lying in bed too long. The alternating pressure mattress automatically changes which areas are inflated to prevent constant pressure on the same body parts. The nursing assistant helped the resident with ambulation by walking slowly with him down the hallway. After being in bed for several weeks, the resident developed atrophy in her leg muscles, making them weak and smaller. The nursing assistant placed a bed cradle over the resident's legs to keep the heavy blankets from pressing on his feet. The doctor put a cast on the resident's broken arm to keep the bones still while they heal. Contractures developed in the resident's fingers because she couldn't move her joints regularly after her stroke. The resident has the right to decline any treatment or procedure that she doesn't want. The nursing assistant checked the resident's skin regularly to prevent decubitus ulcers from forming on pressure points. The resident's disability affects her ability to walk, so she uses a wheelchair to move around the facility. The egg crate mattress has a bumpy surface that helps distribute the resident's weight more evenly. The doctor was concerned about embolism risk, so the resident wore special stockings to prevent blood clots. Eversion of the foot means turning the sole outward, away from the other foot. The interdisciplinary team included the doctor, nurse, social worker, and physical therapist working together for the resident's care. The nursing assistant placed heel/elbow protectors on the resident to prevent skin breakdown from rubbing against the bed. A soft fleece pad was placed under the resident's back to provide extra cushioning and comfort. Flotation pads filled with gel were used to reduce pressure on the resident's tailbone area. The footboard at the end of the bed kept the resident's feet in the correct position to prevent foot drop. After her stroke, the resident developed hemiplegia and could not move the left side of her body. The goal of rehabilitation is to help residents achieve maximum independence in their daily activities. Inversion of the foot means turning the sole inward, toward the other foot. Each joint in the body allows bones to move in specific directions, like the knee bending and straightening. The resident needed open reduction internal fixation surgery to repair her broken hip with metal screws and plates. Paralysis in his legs meant the resident could not feel or move his lower body after his spinal injury. The resident with paraplegia cannot move or feel his legs but has normal function in his arms and upper body. The nursing assistant performed passive range of motion by gently moving the resident's arms and legs through their normal movements. Phlebitis caused swelling and pain in the resident's leg vein, requiring medication and elevation. The resident developed pneumonia and needed antibiotics and breathing treatments to clear the infection from her lungs. Pressure ulcers form when blood flow is cut off to skin areas that have too much pressure for too long. The resident learned to walk again using a prosthesis after his leg was amputated due to diabetes complications. Quadriplegia means the resident cannot move or feel his arms or legs due to a high spinal cord injury. Range of motion exercises help keep joints flexible and prevent stiffness in residents who cannot move regularly. Restorative care focuses on helping residents regain as much independence as possible in their daily activities. Risk factors for pressure ulcers include being bedridden, poor nutrition, and decreased sensation in the skin. Self-care activities like combing hair and putting on clothes help residents maintain dignity and independence. Stasis pneumonia can develop when residents don't move enough and fluid collects in their lungs. Thrombophlebitis is a serious condition where a blood clot causes inflammation in a vein. The resident's broken leg was in traction with weights and pulleys to keep the bones aligned while healing. Trochanter rolls made from rolled towels were placed along the resident's hips to prevent her legs from turning outward. Turn, cough, deep breathe exercises help prevent pneumonia by keeping the lungs clear and expanded. The waterbed filled with warm water helped distribute the resident's weight evenly and prevent pressure sores.